95.9 FM, WATD, the South Shore's Morning News on a Thursday. I'm Rob Hackala, and it's that time of the week we check in with Dr. John Hayes for a better experience at the doctor's office. Try Dr. John Hayes' new, highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com. That's drjohnhayesjr.com. This is our Living and Practicing by Design segment, and Dr. John Hayes is with us in studio every Thursday at this time. Good morning, Doctor.
Hey, Rob. Good morning.
Great to see you on this.
Yes, same here.
Happy spring, I
guess.
Got to say that.
Absolutely.
This is an interesting question. I think this would be great to answer and talk about. So the question is, what is it like to be a patient in my direct primary care practice? It's a great question. This will really kind of describe and give people a real sense, I guess, more about what you do and how you do it.
Yeah. So what I'd like to do is start out by saying, we're so fortunate in this area. We've had so many wonderful physicians and still have over the years, but there's very few of us left that are actually independent. And I'm the only local one who doesn't accept any insurance in direct primary care. Mm-hmm. And so the whole concept of direct primary care is to have personalized patient medical care without any type of interference from an insurance company or a third party telling us what we can't do, what's covered, what's not covered, et cetera, and so on and so forth. So it's a choice. It's a choice that I made primarily because it's how I was raised, how I've grown up, how I was trained over the years, and I think it's the type of experience I know patients are clamoring for because we're told that all the time.
Okay.
So, I mean, that's like the stage.
Yeah.
But in terms of the other things that are really, I want to just tell patients what to expect when they come in. It's not like walking into the typical doctor's office. When you walk in, you don't see any drug ads, you don't see any vaccine posters. All you basically see is some pretty pictures, Marshfield, Nantucket, surrounding coastal communities, and so on and so forth. We want a very, very relaxed, chill atmosphere for patients. Getting to a physician, especially when you're sick, you don't feel well, or if you're a kid or a parent who's sick, you want to be relaxed. And that's what I tell patients all the time. I say literally, this will be the most chill medical practice you've ever been to.
Really? Okay.
Yeah.
Well, that's a good question. You mentioned, is there a specific age that you see people? Because I don't know.
Well, all ages.
Really?
Yeah.
Okay.
So I'm board certified in family medicine. So when we trained in family medicine, we trained extensively. It's really cradle to grave.
Yeah.
I spent a lot of time in, everything from neonatal, right up to hospice care. So
Wow.
I've had phenomenal training, and I'm really honored to be able to present that in this area.
Okay. And you mentioned with this type of practice where it's direct primary care practice, you do have the ability where you're seen, you say, always by yourself, a board-certified family medicine physician, right? You
Correct.
talk about not a PA.
Correct.
Or
Correct.
something.
Yeah. I mean, it's no secret now that with corporations in charge of a lot of health care, the reality is, and I don't think a lot of patients are aware of this, many corporations would much rather pay a PA or nurse practitioner the fraction of a salary that they would pay a physician.
Yeah.
Unfortunately, that's like corporate reality. And it's become so blatantly obvious over the last 10 years when you look at how many graduates there are now from NP and PA programs. Not that they're not very beneficial to healthcare, because they can be, but they have a fraction of the training that we get as physicians. And, patients know that, which is, one of the reasons that when they go to urgent care, for example, they're not seen by a physician. Oftentimes they end up in our practice.
Okay. And you talked about the administrative process is also simplified?
So simple, especially with the modern technology that we have. It's become even easier. The software we have, it's completely encrypted. It's completely safe. We can store all types of information. We can transmit pharmacy orders. I can correspond with patients like that. So it's a game changer. It's been a huge advantage to the type of practice that I want to have.
And we've talked about a lot of the other things about your specific background and the other skills that you have, Dr. Hayes. You say that there's a wide range of services beyond just primary care.
Correct. So, my forte and the reason that I ended up going after many years in chiropractic and clinical nutrition into medicine is that about 15 years ago, as you know, I was here at WATD doing the show Beating Neuropathy.
Yes.
And at that time, I was treating sicker and sicker and sicker patients. I had a lot of physicians actually seeking me out to find out what I was doing, what was working to help these patients. One thing led to another. I went back to med school in my 50s, and here I am now back in practice. So it's been cool. But a lot of the stuff that I started to utilize then has also grown tremendously. We now have people that we communicate with internationally in the field of laser medicine, photobiomodulation. I've done a lot of work with that in my practice over the years, and it's just getting broader and broader and broader. The tools are excellent. Not only the in-office tools, but the home care tools that we now have for patients are also extraordinary. So it's become refined, and the thing that I really enjoy about my practice now, Rob, is I get to integrate these into primary care, because one of the biggest reasons the biggest reasons patients seek out a physician, two biggest reasons: headaches and back pain. Number one, all the time. Somebody comes into my practice and they have headaches or back pain, just as an example. They have chronic pain. What usually happens in most primary care offices? Well, okay, so here's a medication that might help you. Go to pain management. Well, wait 6 weeks for that. When you go to pain management, what are we going to do? Well, our options are very limited. We have this injection, that injection, but we're not going to prescribe for you. Patient leaves. What happens? Okay, so maybe try PT. So that's another 3 or 4 months. And before you know it, a lot of these patients are in chronic pain. Whereas in my practice, I have the ability to stop that right from the get-go because of my skill set and my experience with chronic pain. I can actually combine that care into the patient's primary care experience.
Wow. Okay.
Yeah,
so
that's one of the things
sooner
that makes
and faster.
Exactly.
And like everything that we've talked about, and you know this, and we've touched upon this, everything in medicine, it seems like the longer you wait to treat something, the worse it. That's the lesson I feel like with
it is, and it just gets harder. It's much harder on the patient, and you have all these comorbidities that go along with it. The least of which is unemployment. People get so.
I know. I think
sick,
about you're on disability. If you've got severe back pain, you say, doc, give me another steroid or some other thing, and you're saying that with your system and the way it works with your practice, you can get seen by you. First of all,
exactly,
and then get the treatment plan going faster.
Right, and the biggest advantage that we have with laser, soft wave therapy, and that type of thing, we have all these conservative options we can actually use right in house, and we have the home care tools complementary for patients if they're appropriate.
Now, Dr. John Hayes, still openings to join the practice. You mentioned all ages, and we'd love for people to get a tour or ask questions and perhaps visit the office and find out if it is right for you. There are still openings?
There are. Yep.
Okay.
Absolutely, positively.
This is great. Okay, so if you're ready to join the practice with Dr. John Hayes, there are some openings. He would like to talk to you. And how do people get in touch with you?
The best way is by phone. Shoot us a text. Text is usually easier, but you're welcome to phone and leave a message. It's the phone number, the 781-659-7989.
All right, 781-659-7989, 781-659-7989, and that's Dr. John Hayes. And he's with us every Thursday at this time. It's Living and Practicing by Design with Dr. John Hayes. Dr. John Hayes, thank you.
Thank you, Rob.